Hello, I am Dr. Ajith Kumar A K. I am the lead consultant in critical care at Aster Whitefield Hospital, Bangalore. Lung or respiratory system is a very commonly involved organ, in a critically ill patients. And one of the commonest, disease or disorder which is coming to the ICU with the lung involvement is pneumonia. We all know that pneumonia is basically an infection and inflammation of the lung. And you all may be remembering the deadly COVID pandemic where, the predominantly lung involvement in pneumonia was the worst cause. Subsequently, the patient was going into multiple other organ involvement. And you are aware that there is ongoing outbreaks of an H3N2 which is happening in India, which is again, the lung is a predominantly involved organ, at least in the beginning. And what happens in pneumonia, what we do is that we support the patient's life. We give antibiotics, we give special oxygen devices for oxygen delivery and all. And in a small percentage of the patient with pneumonia, what can happen is it can get worse. There is some kind of a water logging which will happen to the lung. We call it ARDS or acute respiratory distress syndrome, which is again shows that the pneumonia is much more severe. And sometimes, most of the time, what can happen is that whatever the ventilatory support what you're giving to the patient may not be sufficient to maintain the oxygen level in the blood of this particular patient, and the life is definitely going to be threatening. In those conditions, in Aster Whitefield ICU, we have special lung bypass machines are there. We call it ECMO, extracorporeal membrane oxygenation, where the impure blood can be taken from the patient's body through pipes, and it can be put through the artificial lung outside the body, and it can be the oxygenated blood or purified blood can be sent back to the body through another pipe. So, and that's a very important part in the management of ARDS patients. Another type of patient which had come to the ICU include patients like COPD patients. These are smoking related lung disease patients who are already breathless, and their breathing difficulty will increase whenever they get another infections. And sometimes asthma patients who are already having breathlessness, they can also get precipitated by any viral infections or bacterial infections. When these patients come to the ICU, sometimes they can go into very severe situation where they may require putting a tube in the throat and connecting to the breathing machine called ventilatory support. So we have the best of the best facilities in that regard as well in Aster Whitefield ICU. So what I mean to say that at Aster Whitefield ICU, we have an excellent supporting measures, excellent trained nursing staff and the medical staff and the physiotherapy staff to provide the best care to the patient with any kind of lung emergency or respiratory emergencies.